Bonjour à toutes et à tous. Good morning, everyone. Je suis très heureux d'être ici aujourd'hui en compagnie virtuelle de ma collègue, la docteure Theresa Tam. À l'approche de la longue fin de semaine de la Fête du Canada, nous avons certainement le sentiment que nos célébrations seront plus éclatantes cette année. Notre travail acharné et nos sacrifices y sont pour beaucoup. Si nous avons maintenant retrouvé un semblant de vie normale, c'est en grande partie grâce à la vaccination. Nos efforts collectifs liés à la vaccination et à notre respect des mesures de santé publique ont contribué à réduire les effets de la COVID-19 dans notre pays. En fait, une étude publiée cette semaine dans le journal de l'Association médicale canadienne montre bien que le Canada s'en est remarquablement bien tiré tout au long de la pandémie, comparativement à 9 autres pays, en ce qui concerne les taux de vaccination et les résultats pour la santé. Notre travail collectif et nos succès de vaccination 2 doses ont permis, en effet, de sauver des dizaines de milliers de vies et d'éviter des centaines de milliers d'hospitalisations. Néanmoins, il est évident que la COVID-19 est encore là et qu'elle restera avec nous pendant un certain temps. Continuer à nous protéger et à protéger les personnes les plus vulnérables autour de nous doit demeurer une priorité pour nous tous et toutes, d'où l'importance pour chacun d'entre nous de rester à jour dans notre vaccination. But what exactly do we mean by up-to-date vaccination? Let me be very clear. Up-to-date means you've received your last dose in the past 9 months. Up-to-date means you've received your last dose in the past 9 months. If you've already received a first booster, that's great. And please see if you're eligible for a second or a third booster to remain up-to-date. But my message today, more specifically, is for those that haven't yet received their first booster. The immunity conferred by a primary series of 2 doses of vaccines administered in 2021 has now waned. While you might have gotten infected, risk is high you could get reinfected with all the downfall, including the risk of developing symptoms of long COVID. As health experts and physicians will tell you, it's critical that you go and get the shot that's waiting for you. Les études scientifiques sont claires. Notre protection d'un vaccin initial à 2 doses diminue au fil du temps. Notre niveau d'immunité évolue de manière dynamique en fonction du temps et des variants. Le virus de la COVID-19 évolue et Omicron nous a cruellement fait comprendre que nous ne serons jamais pleinement vaccinés contre la COVID-19. Comme le virus, notre immunité aussi évolue et Omicron nous a fait comprendre que 2 doses ne suffisent plus. Nous devons maintenir notre vaccination à jour. Heureusement, recevoir une dose de rappel contre la COVID-19 lorsque cela est recommandé améliore notre protection. Nous savons maintenant qu'une vaccination à jour permet de réduire les risques de transmission, d'infection, les risques de symptômes sévères et les risques de développer la COVID longue. C'est pour cela qu'il est essentiel que les Canadiens restent à jour dans leur vaccination. Mais qu'est-ce que ça veut dire d'être à jour? Être à jour dans sa vaccination signifie que vous avez reçu votre dernière dose au cours des 9 derniers mois. Si vous avez déjà reçu votre première dose de rappel, bravo. Informez-vous, par contre, afin de savoir si et quand vous serez admissible pour une nouvelle dose. Since April, Canada's National Advisory Committee on Immunization, NACI, has strongly recommended that all people 18 years of age and older get a first booster dose 6 months after their initial vaccines. This applies even if you have previously had COVID-19. Keeping our vaccines up to date will provide us with important protection from the most severe impacts of COVID-19, protecting not only our health, but our healthcare workers and also our economy. We don't want to return to more restrictive public health measures, and luckily, thanks to science, we have an amazing tool that avoids that vaccination. La vaccination fournit une protection importante contre les effets les plus graves de la COVID-19, ce qui protège non seulement notre santé, mais également notre système de santé et nos travailleurs de la santé et notre économie. Nous voulons tous et toutes éviter le retour de mesures restrictives en matière de santé publique et grâce à la science, nous avons la chance extraordinaire d'avoir un outil pour éviter ces mesures restrictives, la vaccination. Je le répète, si vous n'avez pas reçu de dose de rappel à la suite de votre série primaire de 2 doses, le moment est venu de le faire. La semaine dernière, les ministres provinciaux et territoriaux de la Santé et moi-même nous sommes rencontrés. Ensemble, nous avons discuté de la nécessité d'adopter une approche soutenue et coordonnée pour inciter toutes les personnes au pays à recevoir les doses de vaccins recommandées en prévision de l'automne. Hier, le Comité consultatif national de l'immunisation a publié ses orientations provisoires pour la planification d'un programme de doses de rappel du vaccin contre la COVID-19 à l'automne 2022. Il s'agit d'un document important pour appuyer les provinces et les territoires dans la planification de leur programme de vaccination et je remercie le CCNI de son précieux travail. And just yesterday, the National Advisory Committee on Immunization, NACI, released its interim planning guidance for a fall 2022 COVID-19 vaccine booster program in Canada, to which Dr. Tam will discuss in a moment in her remarks. This is important guidance to support provinces and territories in their vaccination program planning, and I thank NACI for their valuable work. À mes homologues de partout au pays, je tiens à le réitérer, le gouvernement canadien continuera d'appuyer vos efforts en matière de vaccination. To my counterparts all across Canada, I want to reiterate that the Canadian government will continue to support your vaccination efforts. En conclusion, et comme nous l'avons appris, il est essentiel de réduire les répercussions de la COVID-19 sur notre santé et sur notre vie. De plus, nous savons que la vaccination demeure l'un des meilleurs moyens de se protéger contre la COVID-19 et ses impacts, notamment sur nos aînés, nos travailleurs de la santé et les patients non COVID qui, autrement, en écopent sérieusement. Plus il y a de personnes dont la vaccination est à jour, plus nous sommes protégés en tant que collectivité et moins nos travailleurs de la santé sont sursollicités. Si vous n'avez pas encore reçu de vaccin contre la COVID-19, sachez qu'il n'est pas trop tard pour recevoir une série primaire de 2 doses. Au Canada, nous avons la chance d'avoir cet outil, qui est la vaccination, un outil extraordinaire pour continuer notre lutte contre le virus. Utilisons-le. As we have learned, reducing the impact of COVID-19 is essential to our health and well-being, and vaccination remains one of the most effective ways to protect against COVID-19 and its impacts. The more people are up to date on their vaccines, the better protected we are as a community. And that means less strain on our healthcare workers. If you have not received a COVID-19 vaccine yet, it's never too late to start your primary series. As a country, we are privileged to have access to such an efficient and powerful tool in our fight against the virus. Let's use it. Maintenant, je cède la parole à l'administratrice en chef de la santé publique du Canada, Dr. Tam, qui nous en dira plus sur le sujet. Merci. Dr. Tam, over to you.
Merci, Monsieur le Ministre. Bonjour à toutes et à tous. While COVID-19 activity indicators, including weekly case counts and severe illness trends, are stable or declining in many areas, COVID-19 viruses are still circulating across the country. Despite overall lower transmission nationally, regional variability continues. Most recently, some areas are reporting increases in disease activity indicators, such as lab test positivity and wastewater signals. In addition, the proportion of Omicron sublineage variants BA4 and particularly BA5 is increasing among sequence variants in Canada. given BA4 and BA5 are even more transmissible and immune evasive than BA1 and BA2, it is reasonable to expect that we will see an increase in cases over the coming weeks. Étant donné que le virus de SARS-CoV-2 continue de circuler dans le monde et que de nouveaux variants apparaissent et se propagent, nous devons demeurer vigilants et nous préparer à une recrudescence dans les semaines et les mois à venir. Il demeure d'une importance vitale que vous continuerez de recevoir toutes les doses d'un vaccin contre le COVID-19 auquel vous avez droit, y compris les doses de rappel. Le fait de rester à jour dans ces vaccins demeure le fondement de notre protection individuelle et collective. Il contribue à ralentir la propagation qui entraîne une recrudescence et diminue considérablement le risque d'hospitalisation et de décès causés par la COVID-19. Les données sur l'efficacité des vaccins du début avril jusqu'au début mai 2022, lorsque l'activité de variant Omicron était très élevée au Canada, indique que le taux d'hospitalisation était environ 5 fois plus élevé et que le taux de décès était environ 7 fois moins élevé chez les personnes vaccinées ayant reçu une série primaire complète et une dose de rappel d'un vaccin contre la COVID-19 que chez les personnes non vaccinées. As the SARS-CoV-2 virus continues to circulate worldwide and new variants emerge and spread, we must remain vigilant and prepare for resurgence in the weeks and months ahead. Keeping up to date with all the COVID-19 doses you're eligible for, including booster doses, continues to be vitally important. Up-to-date vaccination remains the foundation of our protection individually and collectively to help reduce the spread that leads to resurgence and to significantly lower the risk of hospitalization and death due to COVID-19. Vaccine effectiveness data from early April through early May 2022, when Omicron variant activity was very high in Canada, indicate that people vaccinated with a complete primary series plus an additional dose of COVID-19 vaccines had approximately 5 times lower hospitalization rate and 7 times lower mortality rate compared to unvaccinated people. Canada's National Advisory Committee on Immunization, or NACI, continues to monitor the rapidly evolving scientific data. NACI's latest guidance provides provinces and territories with recommendations for planning booster programs to help prevent a strong resurgence in the fall and winter, reduce severe illness outcomes, and lessen the strain on health systems. NACI strongly recommends a primary series with an authorized mRNA vaccine in all eligible age groups. NACI also strongly recommends a booster for all adults, as well as for adolescents who are considered to be at high risk for severe disease. While the timing and severity of a future fall or winter wave is uncertain, NACI recommends that individuals who are at increased risk of severe COVID-19 illness should be offered a full COVID vaccine booster dose, and those aged 12 to 64 years may be offered a full booster dose, regardless of the number of booster doses previously received. Booster doses increase protection by activating your immune response to restore protection that may have decreased over time. At this time, we continue to closely monitor the monkeypox situation in Canada and internationally. Currently, over 3,400 confirmed cases of monkeypox have been reported from 50 countries as of June the 22nd. In Canada, as of June the 29th, 278 confirmed cases of monkeypox have been reported nationally, including 202 from Quebec, 67 from Ontario, 5 from Alberta, and 4 from British Columbia. Based on the latest epidemiological data provided, the majority of these cases are male, range in age from 20 to 69 years. In line with the international trends, the majority of cases in Canada to date reported intimate sexual contact with other men. However, it is important to stress that the risk of exposure to monkeypox virus is not exclusive to any group or setting. Anyone, no matter their gender or sexual orientation, could get infected and spread the virus if they come into close contact with someone who has monkeypox or who have direct contact with their personal or shared objects, including towels or bed linens. As we continue to enjoy the summer months, including celebrating events like Pride, long weekends, and seasonal festivals, let's do our best to enjoy each other's company safely. As tomorrow is Canada Day, I would like to give a special shout out to people everywhere in Canada to acknowledge your continued efforts in helping to control COVID-19. Thanks to our collective action, including achieving amongst the highest vaccine coverage in the world and continuing to adhere to public health measures to reduce spread, it is estimated that hundreds of thousands of lives were saved in our country alone. Our challenge now is to sustain the gains we have made while not losing sight of the continuing threat of COVID-19 to our health. Many of the preventive actions and good personal protective habits we have honed over more than 2 years of managing COVID-19 can also reduce your risk of getting infected and spreading other diseases, including monkeypox. Prevention starts with keeping all of our recommended vaccines up to date and added layers of protection, including hand washing, masking in poorly ventilated indoor or crowded settings, and staying home if you have symptoms to prevent spreading infection to others. Thank you. Merci. Miigwech.
Thank you. I think it's time to turn to some questions. On va commencer dans la salle avec Olivier Ferrand, procès TVA. Merci.
Oui, bonjour. La question est pour M. Duclos. Je vous entends parler aujourd'hui de vaccination à jour. Vous mettez l'accent sur le 9 mois après la dernière dose. Je me demandais si vous étiez en train de préparer le terrain pour peut-être un retour de certaines exigences vaccinales à l'automne.
Bien, l'objectif aujourd'hui, c'est de reconnaître, un, qu'on a très bien fait jusqu'à maintenant durant la COVID-19, que deux, on doit continuer à lutter contre la COVID-19 parce que les experts nous disent et qu'on comprend que la COVID-19 va être encore avec nous durant un certain temps. Et que trois, pour le faire, il faut être à jour dans son statut vaccinal. On a entendu au début de la pandémie parler beaucoup d'être pleinement vacciné. Pleinement vacciné, ça ne fonctionne plus avec 2 doses, et c'est pour ça que maintenant on parle d'être vacciné à jour. C'est une normalisation de ce qu'on comprend et de ce qu'on veut faire lorsqu'on pense à notre statut vaccinal, notre protection contre la COVID-19. Donc on veut ici encourager les gens à être continuellement à jour, et c'est pour ça que le 9 mois, c'est la période qui a été retenue pour guider les gens par rapport à ce qu'ils doivent faire à travers le temps. Maintenant, ça va aussi guider le gouvernement canadien dans ses relations avec les provinces et les territoires. Au cours des derniers jours et au cours des dernières semaines certainement, mais aussi au cours des derniers jours, j'ai eu de très bons échanges avec mes collègues ministres de la Santé du pays. On sait qu'au cours des prochaines semaines, les gens vont vouloir être en vacances. Les Canadiens, les Québécois vont vouloir prendre du repos. L'été, c'est court au Canada, donc on va vouloir en profiter. Mais durant ces prochaines semaines, les gouvernements et les fonctionnaires vont travailler fort pour préparer la campagne de vaccination de la fin de l'été et du début de l'automne pour être prêts. Et mieux prêt à ce qu'on sait être le cas, c'est que la COVID-19 va être encore avec nous au cours des prochains mois. Et ça va aussi guider toute autre mesure que le gouvernement canadien pourra mettre en place.
Bien, justement, je cherche à comprendre si... Est-ce que vous écartez, parce que vous parlez d'inciter, encourager la vaccination, est-ce que vous écartez le retour d'exigences? Parce que même si les mesures sont levées en ce moment, il y a des manifestants qui s'en viennent aujourd'hui parce que peut-être, justement, ils craignent le retour de certaines mesures. Quel message vous avez pour ces personnes-là?
Bien, c'est un message de rassemblement. On est tous, je pense, dans le même convoi pour lutter et continuer à lutter contre la COVID-19, qui a eu des impacts terribles, évidemment, sur notre économie, mais aussi certainement sur la santé des gens. Il y a 2000 Canadiens qui sont décédés, des centaines de milliers de gens qui ont été hospitalisés, des centaines de milliers de gens qui se retrouvent maintenant avec des symptômes de COVID longue, des familles en deuil, des gens qui ont perdu beaucoup durant la COVID-19. Donc, on est tous unis dans un centre de même convoi et on sait où on s'en va. On veut être préparé pour l'automne prochain et ça passe par une vaccination à jour qui, à nouveau, repose sur les 9 mois. Donc, si on a reçu un vaccin dans les 9 derniers mois, on est vacciné à jour. Si on est admissible à une 4e dose, donc une 2e dose de rappel, on va la chercher. Ça dépend des provinces. Et au Québec, on a des règles qui sont bien connues. Donc, on va chercher cette 2e dose de rappel si on est admissible. Et si on n'a pas reçu une dose de rappel là, dans les 9 derniers mois et qu'on a reçu donc notre 2e dose il y a longtemps, bien, on va chercher la 3e dose parce que c'est important pour se protéger.
Merci. Now we'll go to some questions on the phone. If I have it right, we're going from Olivier to Oliver. I believe we have Annie Bergeron, Oliver from CTV on the line. Please go ahead.
Hi, thank you very much for taking my question. My first one is to Minister Duclos. I'm just wondering if you can explain to me the rationale for continuing the Arrive Canada app.
Well, the better person to answer that question would be Minister Mendicino, who's the public safety minister. He would have explained, I think, just recently that ArriveCan has obviously been a very important tool during COVID-19 and remains important for those people that enter into Canada to identify whether they are appropriately vaccinated. But increasingly, ArriveCan is also being used to facilitate and accelerate entrance into Canada through customs data entry, which in many cases makes it quite fast and quite efficient to enter into Canada using that particular tool, which has been developed for other purposes to make our customs system even more efficient.
Okay, actually CBSA has said that the Arrive Canada app tends to slow things down, and I assume there was a public health rationale for keeping it, but I will move on. You are here with Dr. Tam today encouraging people to get a 3rd dose, and for months, both of you have been saying that that is far superior to a 2-dose series. So why hasn't the government changed the definition of fully vaccinated to 3 doses instead of 2?
We want to build on the success that we've had with 2 doses. Dr. Tam spoke to that earlier. And that success is not only a cause for legitimate pride in what we've done until now, but also a source of hope for the future, because Canadians in such a large number have received 2 doses, which used to be called, and so still called, primary series fully vaccinated. Because we have had so many Canadians receive those 2 doses, first 2 doses, we have saved thousands, tens of thousands of lives and hundreds of thousands of hospitalizations and many people not having ended up with symptoms of long COVID. Healthcare workers have been better protected because of our collective success. That has also helped not increase even further the delays and the cancellations of diagnostics and treatments for non-COVID patients. It has obviously protected vulnerable Canadians and immunocompromised Canadians who, despite the fact that they may be vaccinated or not appropriately and sufficiently protected against COVID-19, reducing infections and transmission, and many other positive things for the success, linked to the success we've had in Canada. Now, that success tells us that we can look forward to continuing the fight in the fall. We know COVID-19 will be there in the fall. I have talked to my colleagues, ministers of health across provinces and territories. We all know and we all agree that we need to work together very closely in the next few weeks while Canadians have a break, a summer break, which they all very much deserve. But we will be active. Our officials will be active. Our public health officials will work together so that we are able, towards the end of the summer and early in the fall, to make sure that as many Canadians as possible are up to date in their vaccination status.
Thank you. Just a reminder, if you're dialing in to use the raise hand function if you wish to ask a question, and a reminder to use some of the best practices to avoid outside noise. Next, we have Jamie Morker from Global News. Please go ahead.
Hi there. I want to start off with COVID and talk a little bit about the vaccines that we have coming down the pipe for different variants. So we know that, we need protection against BA4, BA5. There are some Omicron-specific variant vaccines in the work. Will Canada have those in time for fall, and what efforts has the country made to secure those vaccines?
On the science, I'll turn to Dr. Tam, and then I might add a few words on the procurement. Dr. Tam?
Yes, so manufacturers, including the mRNA vaccine manufacturers such as Pfizer and Moderna, but others too, such as Novavax, have been looking at broadening their vaccine repertoire by including, for example, a Omicron variant in the vaccine. So I think people have heard about the bivalent vaccine, for example, from Moderna. Pfizer is also looking at very similar constructs. You've probably heard about in the United States, the deliberations of the FDA, the advisory committee that advises the FDA. So I think the first step is that we need the data from the companies, and some of them have been released in their media or briefing materials, but we need them submitted to the regulatory authorities. And that hasn't occurred as yet in Canada, but we hope that they will submit those to Health Canada as soon as possible. But there is a very important discussion, I think, on the regulatory front. How do we shift strains? And how do we look at the benchmarks for superiority of those strains compared to the existing ones? So Canada will, of course, evaluate those vaccines as they come on board. And the timing is interesting, and that's why I wanted to sort of explain the process, is that I think manufacturers have been working on like a BA1 Omicron variant bivalent vaccine. Some may be working on BA4 and 5, but that hasn't been as readily available in terms of data. And the timing then of the availability of vaccines are dependent on that those steps being done as quickly as possible and safely as possible. So we don't know as yet, I guess is what I'm saying, but people are working really fast. I do have to say that, just to reiterate, that the current vaccine is still very effective against particularly serious outcomes and deaths. And so getting that booster and using that at the beginning of the fall campaign is something that can be done while waiting for the results of the other vaccines. I do think that right now, broadening, looking at ways to broaden that immune coverage and our immune response would be a very important objective.
Sorry, Minister Duclos, did you want to add to that?
Yeah, I'll just add briefly that we being the government, and Minister Tassi in particular being the minister responsible for procurement, we're very actively working with companies, Moderna and Pfizer in particular, to be ready if we need to be ready with the purchase and delivery of these new formulations.
So, sorry, it's just not clear to me. If Moderna, say, or Pfizer puts in their application, will we get enough of these vaccines in time for fall, for this rollout, for these boosters that you're asking people to get?
Well, our contracts with both companies allow us to have access to the most recent formulations of the vaccines.
It's true. I'll just also flag that, of course, people are working as fast as possible. Timing depends on that regulatory and other processes. But I would say that when the vaccines first roll out, it won't be, we don't know what the supply is, and NACI will make certain recommendations, for example, for prioritizing high-risk populations, perhaps as they did at the beginning of the vaccination campaign, depending on the supplies that we will get.
Thank you so much. Am I able to ask a second question? Do I have time, Matthew?
Yes, please go ahead.
Okay. I just wanted to clarify as well, we're talking about not being fully vaccinated or not being considered fully vaccinated, whatever the language you want to use is, after that 9-month mark and getting a booster dose. I know, Dr. Tam, in the past, you have mentioned that, after 6 months is when that immunity can really start to wane and potentially even before. Can you just clarify a little bit about how we landed on that 9-month? And Minister Duclos, can you be very clear? Will you be changing the, what is considered fully vaccinated, the definition of what is considered fully vaccinated? I think people really just want to know, will that be changed to include a booster dose, or can we be certain that that won't change?
We'll turn first to Dr. Tam for the timing, the different number of months to which you alluded, and then I'll say a few words at the end on up-to-date vaccination.
Yeah, so from the National Advisory Committee on Immunization's perspective, they recommend an interval of 6 months between that second dose and the booster, that first booster dose. But provinces can also, depending on the epidemiology and context, shift that to shorter timeframes, and some of them did. People can also wait 3 months after they got infected to get the booster shots. So even after infection, it's recommended you get that booster. And so I think what Mr. Duclos was trying to clarify was that if there was a definition of up-to-date for administrative purposes, having that 6 months plus giving people room for, if they had an infection, to have waited that 3-month time frame, that is how that 9 months was arrived at. But really, if you haven't had your booster within that 6-month time frame, you can get it now.
And that's the point. No, it's about up-to-date vaccination or up-to-date vaccinated. So we all want to ask ourselves whether we are up-to-date in terms of our vaccinations. And to be up-to-date means that we've had a dose of vaccine in the last 9 months. Now, 9 months exactly for the purpose Dr. Tam mentioned. NACI recommends 6 months. So after 6 months, you should be receiving your third dose if you've had your 2 doses. But then you may need a bit more time just to get an appointment. And if you've been recently infected, you might not want to receive that additional dose right away. So 9 months seems to be a reasonable time for people to be expected to be receiving their additional dose and therefore to keep being up to date. And by the way, if I may add, about 60% of adults currently would be would have had a third dose, so they would be considered to be up to date in that particular sense. But that means that another 30% or 40% of adults would not be up to date as of now. So that's why in the next few weeks we will be working with provinces and territories to make it easier and to encourage all those Canadians to be receiving their third dose and to give them the level of protection that a third dose would provide, given what experts tell us. Now, I would also say that as we do that, we'll be able to catch up with some of for the fact that we are behind most other G7 countries in our rates of third doses, and we shouldn't be behind because we've been ahead of all those other countries with 2 doses. So we know that we have the capacity and the ability to do better, and we'll do better because we'll be working together.
Thank you. One last reminder to use the raise hand function for the reporters who may be interested in a question on the line. meantime, while we check on that, Dr. Tam, I recall your Twitter account had a message of several months ago on, how to speak to people in an empathetic way regarding health concerns. As we go into the Family Day long weekend, Canadians may encounter people who have different views on public health and what they're supposed to do. I'm wondering if you can give us some comments, or perhaps you as well, Minister, about how do Canadians talk to each other about health issues that have become difficult or divisive, or people have other concerns?
Yeah, maybe I would start, and this is, I think it speaks to the strength of Canada, and as laid out in one of the recent publications in the Canadian Medical Association Journal, we actually did quite well compared to other similar countries, and that's because of cohesion within our communities. And adults 18 plus, 90% of them got 2 doses of the vaccine and doing quite well, and great effort at 60% on the 3rd dose. We want to support them to sort of make that better. So I think on the whole, Canadians have done really amazingly well in both following the public health advice. So it is difficult, and it happens in family situations or other settings where people do disagree on different views. And as much as possible, having a, obviously still listen to each other, find common ground, but also point people towards, credible information is really important. And I think from the Public Health Agency, the Health Canada, and others in the federal government, we've been trying to provide the information necessary for people to have those difficult conversations. But it's not easy, but I think build on our strengths and how far we've come. And it's not just about protecting individuals, it's about protecting each other and protecting our communities. So if people can bear that in mind, I'm sure that they will be able to continue to practice those good personal protective measures that we've all learned to do over the last 2+ years. And happy Canada Day. And we need to celebrate what we have already accomplished, I think.
It's really well done. And so celebrating our success and celebrating our sense of solidarity in supporting each other and continuing the successful fight we've been having against the disease.
Thank you. I believe we have one last question from Alison Northcott, CBC. Please go ahead.
Hi, I'm just wondering what you would say to Canadians who might be wanting to wait for those more specific targeted vaccines that are in development before they go and get a booster, knowing that that might be on the horizon.
Yes, it's Theresa Tam. I'll start, and we actually have Dr. Matt Tunis, who's on a call to support us from the NACI perspective as well. I think for now, we are still waiting for the regulatory process and looking at how much benefit the bivalent vaccines, for example, would provide. And they may provide some marginal benefits, and we need to sort of get a handle on that. But for now, we do know that the vaccines that we have can boost protection, particularly in the period of time soon after vaccination against infection, as well as actually quite enduring protection still against severe outcomes. So I think Canadians should focus on that particular fact as they make the decision to get the boosters. And NACI will provide further recommendations should the newer vaccine formulations get authorized in Canada. But I think depending on your local epidemiology, as cases go up, like BA4 and BA5, as indicated in some areas of Canada, getting that booster, if you haven't had it now, would be quite important, in particular going into the fall. So I think I would leave it at that, and I don't know if Dr. Tunis has anything else.
Yeah. Thanks, Dr. Tam. I would add that from the NACI statement, the committee continues to strongly recommend that the first booster dose be offered for those 18 and over or adolescents at high risk of infection, as Dr. Tam mentioned in her opening remarks. So that, that advice stands. The committee has provided this week a forward-looking statement and forward-looking advice about a program in advance of potential fall resurgence and at times when we know the health system capacity can be particularly strained. But the committee has not been prescriptive about exactly when that new program would start. And the committee advises in their recommendations that individuals should be listening to their local public health authorities about when exactly the right time will be to take that new booster dose. So we know that jurisdictions have variable epidemiology across the country and might have slightly different start dates to when they launch that fall booster program, and that's acknowledged and appreciated by the committee. So that, of course, makes this question of timing complex. When exactly individuals should be receiving additional booster doses and exactly what formulation. As Dr. Tam mentioned, there is still a considerable uncertainty that also the committee acknowledged in their statement about the exact timing of and availability of new formulations and exactly what those new formulations might contain. So as that's being worked through with regulators over the summer, which does take time, right? That once, for example, Moderna or Pfizer submit those data, the regulator needs to do their due diligence and is going to conduct that full regulatory assessment in Canada. So that will take time as we work through that. And then NACI, as an advisory committee, will additionally look at that evidence and the availability of the products at the time, also considering the epidemiology at the time when those products become available, and then can further advise on where they could be most impactful. And at that point, I think we might expect to see more granular advice about product selection, and if there are actually superior products that should be used for certain individuals, then that would be elaborated at that time. But really right now, there's so much uncertainty about the environment overall that the committee was quite clear that their advice stands around first booster doses for those who haven't received them, and also around second booster doses for those that have already been strongly recommended. So for example, those 80 and over or those in long-term care settings, all of that advice remains from the committee, and they're trying to look forward and provide this planning guidance, which is what it is. It's planning guidance. It's not prescriptive. It, as much as we would like it to be possible, even the committee is unable to predict exactly how the future will unfold. So they're providing us with the best advice at the time to look forward to that future potential reality of additional products and also additional epidemiological concern in the fall.
Follow-up, Allison?
Thanks. And how challenging do you think it will be to convince people to go back for more boosters?
It's Theresa Tam. Maybe I will try and answer that question. It can be quite challenging, but as we said, even 60% third dose is actually quite a good effort. We just need to understand why the rest of the adult population who got 2 doses didn't get their third. And I think we have some details as to why they're not getting that third dose. So for example, I think some people were wondering whether if they just got infected, why should they get that third dose? And so I think the NACI recommendation, I'm trying to explain to people why, even infection-related immunity, particularly as it pertains to Omicron, could wane over time. Getting that boost is important, as NACI had recommended. And there may be other reasons as well. So we've got to be, as well as accelerating broad-based campaigns, is actually continue to do those more targeted community-led efforts that tries to understand why people are not taking up the vaccine as much as possible. But I think To date, Canadians have followed advice. If we explain to them that, in fact, protection from the vaccine could wane over time, the virus is changing, and it's important to, ahead of a respiratory virus season, which I think many people do understand, like influenza and other viruses, they can be very much encouraged to get vaccinated. Having access, as we all know, making it easy for people to make healthy choices is very important. So all of those things that we did so amazingly well can be leveraged for the booster campaign. One thing that I'm quite encouraged is that a lot of provinces are also supporting pharmacists at giving out vaccines, and that increases access, of course, in different communities. And you can get those even without a public health clinic. There are many communities where access can now be done with pharmacies. And so I think it's an all-out effort using multiple approaches to get people the vaccines that they need. And the Public Health Agency, the federal government, will continue to fund community-based projects that increases awareness, education, as well as supporting decision-making from leaders and credible voices in those communities.
And I would add, it's, as Dr. Tam just said, it's about making it easy to understand and making it easy to do. So first, understand, so a clear language. The 9 months is very clear and will help people understand why up-to-date is the right way to think about vaccination now. Now, fully vaccinated makes no sense now, so it's about up-to-date. So am I up-to-date in my vaccination? Have I received a vaccine in the last 9 months? And if not, then am I eligible to receive a new dose of vaccines? And then add easiness to access, as Dr. Tam said really well. It's about ease of access, and for particular communities, that's very key. For more marginalized, more remote communities in particular, access is key. And many Canadians are very willing to have to be up to date, and will be very willing to be up to date, but they will require their governments to make it relatively easy and as easy as possible to access vaccination.
Thank you. We've had one other question come in. Cassandra Skoslarski, Canadian Press. Please go ahead.
Hello. Can you hear me? We were just wondering about monkeypox. Is Health Canada or has NACI perhaps reconsidered advice or plans for wider distribution of the vaccine for monkeypox, as we've seen the US and the UK both expanded their programs?
Yes, it's Theresa Tam. Just to remind people that NACI did make a recommendation for monkeypox vaccine already. And that includes the what we call post-exposure prophylaxis, which is the provision of vaccine to people who may be in contact with a confirmed or probable case within that sort of 4-day to, preferably as soon as possible, but the 4 to 14-day time frame. So that recommendation has been provided, as well as some very targeted prevention or pre-exposure vaccination for some population groups. But I think together with the provinces, particularly Quebec, Ontario, but also the other 2 provinces that have had cases, we've been having conversations with the provinces on the approach to the vaccination, including the provision of vaccines to groups or settings that may be at higher risk. So that's been done at the local level. And the supply comes from the Public Health Agency's National Emergency Stockpile System. And we've been having very close bilateral discussions with provinces in terms of the supply as they begin to draw down on the supply allocated to their particular jurisdiction. So I do think that Canada, compared to other countries, has mobilized quite a bit of vaccination. And I'm hoping that we can draw some evaluations and lessons learned from that, our current experience as well. That's really important.
I would add, Dr. Tam, also that that NACI as a committee has committed to also monitor the evidence landscape as it evolves. So if there is a shift in evidence, either from international spaces or from Canadian evidence as is being generated within the country now, then the committee would update guidance as needed. But as of now, there are no imminent updates planned from NACI.
Thank you. Well, as a follow-up, Dr. Tam, on supply that you mentioned, can you provide numbers on how many doses of the vaccine for monkeypox we have available?
We just don't generally comment on what's in the stockpile, but all to say is that the provinces that are carrying out vaccination have what they need. And I believe, Quebec has been quite active, and they've been providing vaccines, I think now to over 7,000 people. And in Ontario, they're also been escalating their efforts. And I think in that province, I don't have the number right in front of me, but maybe around 5,000 or so. So, and they have what they need for now, but we're maintaining close contact with them as they make progress. And we're, of course, and I think that's public information, Minister may or may not wish to comment on it, and of course there is continuing discussions and contract negotiations with Bavarian Nordic, the manufacturer, to access more.
All right, those are all the questions we have for today. Thank you for everyone's time, and happy Canada Day. Merci beaucoup. Miigwech.
Thank you.